So in terms of monitoring, regular consultation with your doctor is recommended. Your doctor will usually order regular blood tests with each visit to monitor your inflammation markers, and also routine blood test monitoring of your blood count, your kidney test, your liver test while you're on oral medications or injection medications. Your cholesterol and blood sugar should also be monitored regularly. And other tests for bone health, such as the vitamin D blood test or the bone mineral density test, may also be ordered, not in every visit, but maybe once a year or once every few years. Your doctor may also ask you to do this questionnaire known as the BASTI, which is to help calculate these BASTI and ESTAs, which are used as what we call disease activity markers. This one just takes into account this questionnaire, whereas this score does also take into account the blood test, and there's a calculator available online that we can use to calculate the score. So this generally helps us to provide as a guide to how active the disease is. But we also need to remember that as this is a subjective score, different patients may have different pain threshold, different threshold of the level of tiredness, fatigue. So the absolute score is not the only thing that's important, but also a trending of the score to compare before and after and while on treatment. So in terms of imaging such as X-ray or MRI, it may be repeated, but only depending on the clinical condition. It is not routinely repeated. So other things that your doctor may do include giving you this survey to do to test for your function and to assess the degree of functional limitation. And also some measurements may be done to check how mobile and flexible your spine is. So in summary, axial SpA is a chronic arthritic disease consisting of ankylosing spondylitis and non-radiographic axial SpA. There's a wide spectrum in terms of pain and disability caused by axial SpA. AS and non-radiographic axial SpA are conditions on the same disease spectrum of axial SpA and may be characterized to be at opposite ends of the spectrum. However, non-radiographic axial SpA does not necessarily develop into AS, and AS does not necessarily advance to bamboo spine. The predominant symptom of axial SpA is chronic pain and stiffness in the lower back, commonly lasting more than 3 months, typically worse in the morning and with inactivity, usually occurring in an adult less than 45 years old. The disease may wax and wane with intermittent periods of flare in which the disease is active, and remission with inactive disease. Occasionally, axial SpA may be associated with other joint symptoms or other conditions such as eye inflammation, bowel inflammation, and psoriasis. There's no one single direct test for axial SpA. Diagnosis is based upon a combination of symptoms, physical examination, blood tests, and imaging tests such as X-ray and MRI. Treatment includes medication, exercise, posture training, and rest, and the same treatments are effective in both AS and non-radiographic axial SpA. And although axial SpA is a lifelong illness with no cure presently, with adequate treatment, most people are able to lead productive lives. So this is my last slide, and come to the end of my presentation. Thank you for your attention.